Hello and welcome to Stork'd, the podcast in which we explore the many ways to build and define family. This is your host, Julia Carroll. And I have a question for you. Do you get confused by fertility math, all those numbers around how fertile am I, how long will I be fertile, egg count, egg reserves, follicle count, etc.? Or are you just starting the process of thinking about what is my fertility and how do I map out my family life? Well, this is your episode because Dr. Bendikson breaks that down for us insofar as you can demystify some of this fertility math. To be honest, the fertility math is partly so confusing because the data changes regularly, and it's confusing because it's so deeply personalized. It's so individualized to your levels, your numbers, how old you are, what you want from your life. And the only person who can help you navigate that is a doctor that you speak with one-on-one. So I like to think of this episode and this conversation as getting all the basics on the table so that you know how to have a conversation with your doctor or when to have a conversation with your doctor. It comes at a time when it is so important to talk about fertility for several reasons. One is that the cultural norms around fertility are changing. People are way more open to think about and talk about their fertility journeys. And the best thing we can do for one another is to talk openly about how we think about our fertility journeys. The other thing that's really important is actually fertility treatments are maybe a little at risk in today's political climate. At the time that Dr. Bendikson and I did this recording, that was not the case. There was no question in my mind that the progress would continue marching forward, that we would continue bending the arc towards cultural progress as it relates to families that look however we want our families to look. And yet, since that conversation, things have changed a lot, and it may not be the case that we have access to fertility treatments in all states in the future. And I think it's really important for us all to take a listen within that context, within the backdrop of, is this even something I can do if I wanted to do it? With all that said, here's Dr. Kristen Bendikson, and I hope you really love the episode. If you do, share it with a friend. You never know who's going to need to hear an episode like this. Don't forget to like us on social media, follow us, join the newsletter, and give us a great review. It really does help. Thank you. So, Kristen, welcome to Stork'd, the podcast. I'm thrilled to have you here. It's actually perfect timing because this week really is National Infertility Awareness Week. And so we didn't plan this, but it's kind of ideal to talk about fertility and fertility treatments.
You're absolutely right. And it's one of those things in my mind, the same thing like occurred to me. I'm like, oh my God, this is so amazing that I get to do this week because this is such a special week for National Infertility Awareness Week. So important to talk about fertility and infertility. And today is really special because Kindbody actually rang the bell at the New York Stock Exchange in honor of National Infertility Awareness Week. It's really a special day.
That could not be more exciting. For starters, the fact that a fertility company is ringing the bell at New York Stock Exchange just shows how far we've come culturally to understanding that infertility and fertility planning is critical. To me, that feels like a really big cultural milestone.
I 100% agree.
In honor of all this cultural change, all this big momentum that's happening in the world around us, why don't you tell us a little bit about who you are and how you are supporting people who are going through their individual journeys, as well as the big picture cultural shift that we're experiencing around fertility awareness?
I have been practicing as a fertility specialist for over 16 years at this point. I was at USC for 15 years, which was such an incredible part of my career. I was in academic medicine, so I was teaching the next generation of fertility specialists, and I found that fulfilling, and I was able to do research and really move the needle in terms of exploring new treatments, ways of improving success with fertility treatments. And I loved that aspect of my job. During my time at USC, I also was heavily involved and still am in the American Society of Reproductive Medicine. I was the chair of the Patient Education Committee. I still serve on the ASRM practice committee, which is the committee that puts out all the documents really for fertility providers, setting the standard of, this is where there's evidence-based medicine, and this is how we can really provide the best care for our patients. That has been, for me, in addition to actually taking care of my patients, has been such a wonderful way to contribute to the greater fertility community. And I have always had such a passion for educating young individuals, couples, men and women about their fertility and reproductive potential. I think that's so incredibly important because, like we were talking about, how momentous it is to have Kindbody ring that bell at the New York Stock Exchange today, moving the discussion about fertility and fertility planning into the open and talking about it early. I think in so many instances where we could actually prevent couples and individuals from the heartache of infertility if we address these things earlier. And Kindbody, it's such an incredible organization because it's really an organization trying to reimagine fertility care and women's reproductive health care in one package. At Kindbody, one of our big missions is education and providing knowledge to people before they have issues. And we address the patient as a whole from this 360 approach, thinking about like, what can we give to our patients in terms of psychological support and acupuncture, and doing it from one place. Because as you know, the fertility and undergoing infertility is so overwhelming and daunting, and therefore it's more accessible, it's more approachable. I mean, there's just so many ways where I feel like Kindbody is really trying to transform the landscape, and that was what was so appealing to me to move over to Kindbody last year.
So let's talk about that a little bit, because what's really interesting to me, and you make it hard as an interviewer because you've got so much to share. And it's at so many multiple layers, right? You've got the patient care, you've got training the doctors, you've got systemic change, transforming an industry. And then you've got the one-on-one human experience that you have with your own patients. That's just a lot, but it means that you're the perfect person to talk about the intersection of where we are now culturally, what's happening with infertility and treatments, et cetera. I just want to pause and talk about some of the words that you just shared with us. I heard words like education. I heard words like accessibility. I heard transformation. I heard affordability. I even heard you say, like, get rid of some of the fear and the uncertainty behind it. I think you even said make it easy, which is never something that is usually traditionally applied to fertility journeys. You don't go in and say, this is going to be easy.
Yes, I would say easier would be a better term.
So I mean, those are heavy, momentous things that you're trying to tackle simultaneous. Can you tell us a little bit about what is it that needs to be transformed? What does the landscape look like right now? And what is your vision, Kindbody's vision for the future?
That's a loaded question because there are so many things. And I think that all of the things that you just mentioned are the things that we need to tackle. And you can go in order from like the very genesis, which is most individuals don't understand that there is a limited time where women can get pregnant in their lives. And it is harder to get pregnant as they get older. And you need to think about what your dream family is early.
Do you advise clients to start thinking about that?
I think you should think about it in your 20s. You don't have to act on it. I'm not saying take action necessarily, but education and learning and understanding and having the option to make choices, thinking about how many kids do I want? When do I want to start trying? When do I feel like I want to end out my family, right? Because some people may feel like I want kids, one after the other. Other people are like, I really want to space them out. If you want 4 kids and you want to space them out, you can't start at 38 necessarily, unless you've frozen your eggs, right? But you have to think about things. Where's your partner? If you have a partner, if you're going to do it on your own, when do you feel like you're going to be ready on your own? If you have a partner, what are their dreams and how do those dreams align together? And do the timeline line up? And then if they don't and things are getting pushed out, what are the things like egg freezing that you can do that can potentially preserve your fertility in the future. If you even talk about that one thing, which is having that conversation multiple times and understanding that the answers to those questions may change over time. And knowing that, I think that is also a really interesting concept. And I was talking to a patient about this a couple of days ago, and that she's interested in egg freezing. And she said, I don't even know if I want kids. She's like, I truly don't think that I necessarily want them, but I am scared that I might change my mind someday. And I think that's the other thing, is that knowing who you are at 22 is not who you are necessarily going to be and what you want out of life at 32 and even 42, and recognizing that. And so that's part of this conversation and just having this conversation.
Yeah, this triggers a couple things for me. The first is I have an emotional reaction when you tell me to think about your dreams and start planning for your dreams, because there's so many factors that can go into preventing us from achieving our dreams, such as, do you have a partner, which was my case, where it's physically possible for you to do that or for your partner to do it. And that's where the fertility treatments come in. Can you talk a little bit about how you counsel your clients when they have a dream and they're faced with the reality that that dream may be a little harder to come by or may not be as accessible?
It's a challenging conversation. It can be really hard. I will tell you, like, personally, as a provider, it is really hard to give people bad news. Like, I look at follicle counts, which the follicles are these fluid-filled sacs that have eggs in them inside the ovaries, and they're a marker of how many eggs you have. So what's called ovarian reserve. And you look at these scans, and sometimes is it 3? Is it 5? And you're like, oh God, do I say 5 because it's going to make her feel better? Do I say 3 because that's like maybe more realistic? But it's really important to be honest and not sugarcoat things. And the other thing that is really hard is that a lot of times I don't have answers for patients. They want me to tell them what to do. And I have to tell patients so many times, I cannot tell you what to do. Like, whether you decide to freeze eggs in this moment or not, I can't tell you that is something that it is worth it for you to spend the money and put your body through this. I can give you all of the little facts. We can tell you how much it costs. I can tell you what you're going to put your body through, give you realistic expectations. But at the end of the day, it's a very personal choice and it's going to take some time. And then what I always tell patients also is, any decision you're making right now it's the best decision that you could make at that moment for yourself with the information that you had. And you have to know that. And then you have to also remember, moving forward in the future, you can't go back and say, I wish I did something else, because remember, in that moment, you made the best decision for yourself. And knowing that in a year from now, you can think about things differently.
It's good advice in life in general, but it's particularly good advice when information is changing regularly, technology is changing regularly, our self-perception and what we want, our relationship with our dreams is changing frequently. And then there's this time pressure. You have all those factors coming together, and then you have to make major life decisions that are going to impact you for the rest of your life, potentially in the heat of the moment with all these emotions.
Yes. Don't make a decision and feel like, okay, I feel guilty and horrible. Did I make the wrong decision? You're going to have to just make a decision at some point. But part of that is knowing that in a month from now, you could be in a different place. In a year from now, you could be a different place. And it is a iterative process, and that you will go back again, potentially again, as life changes.
So let's break these things down a little bit. So we've talked about changing the landscape of fertility treatments in general with regard to access to information, who can actually get access to fertility treatments, making good decisions, and some of those other things around the emotions of it. But there's really two different components of fertility. There's fertility preservation. And to me, that's egg freezing. Maybe there's other ways to think about it. And then there's fertility treatments if you're in the process of trying to get pregnant and you need some assistance. Can you educate the audience a little bit? Let's start with egg freezing. Tell us about when somebody might choose egg freezing, what the process is. What's a traditional egg freezing program look like?
So I think it's important to recognize that starting at 27, things start changing in a woman's body. And starts changing slowly. 30, 32, changes a little bit more. 35 starts really changing. Then you hit 37, 38. I always kind of show this curve to my patients, like with my hands, so like on the screen, it's going down, and that slope is going down faster, faster.
Yeah. And I work in finance. So we always talk about, you want your financial numbers to go up and to the right. And unfortunately, your fertility numbers go down and to the right. And so it's a reverse J curve.
Exactly. What is also challenging about that is that there are three things that are changing. The number of eggs that you have change, how the ovaries are functioning, responding to hormones change, and then also the quality of the egg changes. And with those three things, the first two, like the number of eggs that you have and how the ovaries are functioning, sometimes that J curve drops down much more rapidly than your age. And so you have women who are younger who have less eggs, right? And their ovaries are not functioning as well. And that can happen. Again, we talked about thinking about your goals. It's not a bad idea in your late 20s to go and just have an ultrasound. So with the ultrasound, we can look at something called a follicle count, which is the follicles are those fluid-filled sacs that have eggs, and we can count them in the ovary, and they're representative of the number of eggs that are available in a given month. It's also a good indication of the number of eggs that you have in total in your ovaries. And there's something called an AMH, which is a blood test that is a marker of both quantity, like that follicle count, but also a little bit like how the ovaries are functioning. And the reason that's important is if the earlier you're catching that, if it's something that you want to do where you do egg freezing, where we're stimulating that group of follicles that is available in a given month, normally what would happen is one egg would ovulate and the rest of the eggs would die. And so you're losing that group every single month. With egg freezing, we just give you the same hormones that your brain is sending down to the ovary to make one egg grow. We give you more of that hormone through injections for about a week and a half to make as many as possible of that group grow. And then we take them out and freeze them for you. We haven't made you more infertile because you're going to lose those eggs anyway. And then those eggs can come out and they stay the age that you were when you froze them. And you can get older. And your uterus's ability to carry a pregnancy doesn't change with age. You could have 27-year-old eggs frozen and you could be 38. If you have to use those eggs to get pregnant, because maybe you're not getting pregnant on your own, your chances of getting pregnant are that of your 27-year-old self, even though you're 38.
And I think there's some really important things. I've gone through the egg freezing process, but I went through it a number of years ago. And I think the technology has changed a little bit. So I'm going to ask some questions, is remembering the ones I asked my doctor when I went through it. The first is there anything I can do in anticipation of my egg freezing to either improve the quality of my eggs or increase the number of them so that I get more when I go through the egg freezing process?
You can't change the number. I wish.
Right?
If we could add eggs and make more eggs come out, that would be amazing.
Talk about transforming the industry, but okay.
That would be amazing. And that's not something that is when I think about technology that's coming down the pipeline, there is not something that people are thinking about. I think someday we might be able to just take a skin sample and turn a skin cell into an egg, and then there won't be fertility treatments anymore, right? Because you literally will just go in and someone will just scrape off a little dermal cell and there you go. You can have a family. But I mean, that's ways. In terms of quality, this is a little bit different. It's a more subtle and more gray. There's not hard evidence for a lot of these things in terms of what you can do to affect quality.
And those things are maybe diet or acupuncture, meditation. Are those things? What are you talking about?
I mean, yes. But remember, the vast majority of what is going to determine the quality of the egg is inherent in you and you can't change it. The number one thing is how old you are. That's where you can change it by freezing eggs earlier or thinking about things earlier. But if you're in a moment and you're 38, you're like, great, thanks a lot. I can't go back and change time and be 32 and freeze my eggs anymore. I'm 38. What can I do at 38? And so I think actually one of the more powerful things that's going to move the needle, maybe a little bit, is there's a supplement called coenzyme Q10, which is an antioxidant. And I think a lot of fertility specialists use it because the theory behind it of why it works, one, makes sense. There's good animal data and there is some data in, fertility patients, and it has no side effects and it's not that expensive. So that's an easy thing Does someone who's 27 need to take CoQ10 for a month before they freeze eggs? It's not going to be harmful. But then a lot of these things you always have to balance. It's like you have someone who's 41 and they have time to freeze eggs. And it's like, if you have this moment in time and it's May, do you freeze eggs now? Or do you really need to wait 3 months and take supplements? It's probably, we know that the eggs are growing probably maybe 2 months before like we're actually taking the eggs out. Is it worth it to wait 2 months, 4 months to get yourself in a really good place? I always struggle a lot with patients with this because if you're 40 or even 37, you could wait 4 months and then all of a sudden now your follicle count is down, right? So you have started from a place where you can maybe get 5 eggs and then now you've waited 4 months because you're like, I want to get myself in a better place. I want to eat better. I want to drink less. I want to do acupuncture. And then now you've waited 4 months and now all of a sudden we're only going to get 3. Well, we would have been better off having the 5.
Yeah, it's a little bit of a black box mystery, right? You're playing with numbers that are not readily clear.
Yeah, absolutely. And so I think all of those things like acupuncture, diet, just lifestyle. I also tend to be a person of like moderation. It's kind of like you have to just pick and choose a little bit and not drive yourself crazy doing all of these things, right? To like make your eggs better. And by the way, the studies are there, but they're all like really small. So like even with plastics, it's like high levels of BPA. And so how much is like a little bit of plastic going to harm you? Probably not a lot. So like you can't be stressing about you touched a plastic bottle or a thermal receipt like one time at the grocery store. But it's just being cognizant of those things. And I think in some ways with infertility, so much of the power is taken away from you. And that is really hard. And a lot of patients really struggle with that. I do think it's important to say you can do these little things and they could potentially have an impact.
I can relate to that so much because even if they don't have an impact, it's a little tiny lifestyle change that you can make that feels like you've got control. And worst case scenario just calms your monkey brain. And best case scenario might have an impact on your fertility. That often is a trade-off that's worth it. You know, the uncertainty versus let me do this thing that might help.
I struggle, and just sorry to interrupt you for that, but it's super important. Where I struggle is I want to say these things. I know they're very important for patients. I also don't want my patients to feel like we've talked about all of these environmental things that you can do in terms of just what you're eating in your body, what you're doing, et cetera. And then they go through a cycle and they don't get pregnant. And I don't ever want them to like blame themselves of like, oh my God, I didn't eat enough organic. I didn't wash my strawberries enough. So it is a fine line between like, these are things that we think that might be helpful, but you cannot drive yourself crazy and cause all sorts of anxiety before your treatment, thinking that you have to do all these things. And the guilt of like, I failed, I didn't do those things, and blaming yourself when these things are small compared to the things that you cannot change, which is your age. And for example, if you have endometriosis, which is incredibly common and affects egg quality, affects egg numbers, you can't control that.
Yeah, I'm so appreciating that you brought that point up because it's easy to get caught up in the, if I had only done XYZ, if I had only controlled this thing. So a little of it is in our control. I remember when I was going through my fertility treatments and then ultimately when I was pregnant, my mom, who's very well-intentioned, had read something that stress has an impact on fertility and then also on the baby's health. And so her point was, you have to make your life as stress-free as possible. Well, that's great if you can do that. But then the net result for me was I got really stressed about being unstressed. And so that's, it's not helpful, right? I'm like, I'm now stressing about the fact that I'm stressing. I appreciate that. Let's go back to egg freezing and technology changes. One of the questions I have is, what is a good number of eggs to get? And how do you think about the counts? Because there's the number of follicles that you have in your body. There's the number that are extracted. There's the number that are actually frozen. There's the number that might be able to turn into embryos. How do you make the math make sense for those of us who are new to this?
I think it's important to go through numbers. When I have a consultation with a patient, I go through the numbers. I say, okay, this is what your follicle count is now based on your age and your follicle count and your AMH. This is the range that we think you're going to get in an egg freezing cycle. And it is a range and it's not a number for a reason.
So you
right?
can't tell me in a perfect world, we'd like you to get to X number of eggs frozen.
Yes and no. Well, you have to talk about what is feasible for you based on your follicle count and your AMH. If someone is very interested in numbers of like, I want 2 kids, there are studies. And so there are graphs that we can go over that say, okay, if you want 2 kids and you're this old, you would need this many eggs. We'll give you, a 90% chance of 1 child, but it's going to give you only a 65% chance of 2 kids. And remember, if you are 32 and you want 15 eggs frozen, it doesn't matter if you did 1 cycle to get those 15 eggs or 3 cycles. At the end of the day, you have 15 eggs frozen and you were 32 when you did it, right?
The only difference is the price. Right.
Oh,
so
the price. Yeah. Oh,
whether you can do it, it's different. Right.
Oh,
yeah.
100%. What I think is really hard is that I go through those numbers. I hear it in my patients' voices. I see it in their faces. That number is very hard for them to be like, okay, do I do this or not? Because they want me to say it's going to work or not. Where like, I can't do that. I can only say, if you do this, I think you're going to have somewhere between a 50 and 70% chance of having 1 baby. And here are all the things that you need to do it. And this is what it's going to cost. Do you want to do it?
Yeah. And the wonderful thing about egg freezing is that we have this incredible technology that allows us to preserve our fertility for those people who either don't have a partner like me, or are not yet ready for kids, or are seeing their levels decrease and need to get ahead of it, which we've just discussed. The flip side of the coin is that you're making a huge physical investment and financial investment in something that is not a given. It's something you just gave percentages that it's 50 to 70%. If this happens, if that happens, if that happens. And that's hard.
By the way,
if you want them,
you might not use them. But if you need to use them, you will be so happy you have them, right? And it's a huge ask of people. And I feel that all the time where I'm like, I cannot guarantee you anything. Like, even if you're really young and you get 20 eggs, like, I can't guarantee you a baby. You can never go into this as a guarantee of a baby. However, you're right. And that this technology is amazing.
Amazing. And changing, right? And my understanding too is that the extraction technology and the freezing technology has changed even since I did it 5 years ago. Can you tell us a little bit about what's been evolving technologically and what's coming on the horizon?
With technology, like taking the eggs out is the same. The drugs that we give you are the same. I would say one of the main things that I think has changed for egg freezing in particular that has made the experience a lot better is the ability to trigger with different medications that both decrease the severity of the symptoms after egg freezing and decrease the amount of time that people are uncomfortable and limit the amount of days that people are taking shots. And so there are medications that really make the experience a lot easier, which I think is so incredibly important. And I think that's really key. For the technology, like the freezing technology has changed a lot over the last 15 years in terms of our success rates of thawing the eggs out. There's lots of data to suggest that an embryo that you get from an egg that's been frozen compared to an embryo where like you literally just took the egg out 5 days ago, the implantation rate, meaning the chance that those embryos are going to become a pregnancy, are very similar. But the difference with egg freezing is that the thaw rates with eggs are not as good as the thaw rates for embryos. And people think of that as like a negative towards egg freezing. I think of it as you should think about the technology of thawing out an embryo has just skyrocketed. I remember 15 years ago where we would have these really early embryos and I would be telling patients that like, oh, if we freeze them, it's going to be like a 30% decrease in the chance that this embryo can become a baby. That was a conversation I had every day, all the time, compared to now where I'm like, oh, you have a blastocyst? Like we think it's a 95% chance that this embryo is going to thaw and be fine and we can transfer it. I don't walk into the day of transfer fearing that I'm going to have to call the patient and say, oh, this embryo didn't thaw out. Can we get your permission to thaw another one? Which was a very common occurrence before. And so the technology in terms of freezing has really grown tremendously with embryos. It's so much better with eggs, but it's just not identical to embryos. And what's coming on the horizon is that there is technology that is already out there where you can take pictures of the eggs, right? And then predict what's the chance that this egg is going to become a blastocyst, meaning that what's the chance that once we fertilize it, that it will grow to that stage in the embryo development that we can use it. It's more information. I think it's amazing. Let's say you have a couple, you have a man and a woman, and they want to freeze embryos, but they're also struggling because maybe the woman's like, I kind of maybe want some eggs for myself. And they're trying to make that decision of, do we freeze eggs? Do we freeze embryos? We're not ready to have our baby right now. One of the advantages of embryo freezing is not necessarily that the implantation rate is going to be better with an embryo, but you get more information versus when we have eggs, we have lots of real data that can tell us and help predict, you've got 10 eggs, you're this age, we think you have 60% chance of having a baby. It's more important to identify, are you one of those few people where like your outcomes are not going to be as good? Just kind of like when we were talking about testing your fertility. And so with eggs, wouldn't it be really nice to be able to level the playing field a little bit with eggs and embryos to say, you have 10 eggs, but we did this test and we think based on this test that unfortunately, for whatever reason, the quality of the eggs maybe is not as good, right?
That's really interesting. So you're talking about technology that not necessarily changes the experience, maybe a little bit of extracting the eggs or extracting the embryo, but really changes the predictive analytics that you as a doctor can do to help your patients make more informed decisions.
Correct. Because I think sometimes I have patients that will lean towards embryo freezing because it gives them more information. And I think for certain couples, that makes a lot of sense. It's the same thing like if you are thinking about embryo freezing, do you choose to do genetic testing of the embryos? I think about you really need to consider genetically testing your embryos because if you're trying to use this experience as a way to have knowledge of what you have and really know that you don't want to have children for 3 years, understanding what you really have frozen and really what your chances are of pregnancy is really important. For those couples who maybe know they can only afford to do one cycle, then they're going to be able to get what they can get. But for a couple who might say, we would be willing to do a second cycle, we would be willing to do it again to get to that level where we feel more comfortable, where we're really going to be able to have 2 kids from the embryos that we have frozen. And so freezing embryos, because you get more information, allows you to make those decisions where women who are egg freezing or even couples that are egg freezing, it's more limited. And that's where I think this technology is really interesting, could be very useful.
Okay, we've had a really robust conversation about changes to fertility landscape as a whole, and then fertility preservation through egg and embryo freezing. We haven't even talked about infertility, and maybe we'll save that for a later conversation or put a pin in it for now. But what I'm hearing is that if I, as a single person or a couple, am coming to you, Dr. Bendikson, and saying, okay, I'm ready to start thinking about this, I should be asking first, what is my fertility generally? What is my AMH? How does that compare to the average for my age? How should I be thinking about this relative to my timeline? Is this an immediate thing? Is this a mañana thing? The second thing it sounds like I should be thinking about is, do I want more than one kid? And then the third thing is, if I want kids at all, one or more, I could be thinking about whether I want to freeze eggs or embryos. Are those some of the questions that somebody should be sitting down with a doctor like you and thinking about?
100%. I would say my only little tweak to that would be, it's important to understand about your fertility, but the tests that we can do are not necessarily telling you how easy or hard it is going to be to get pregnant in this moment, or how easy or hard it's going to be to get pregnant 5 years from now. Because the testing that we have is more about ovarian reserve, which is the number of eggs that you have, how well your ovaries are working. Are there things that we can see with a simple ultrasound that might identify issues in the future? For example, we see a cyst on the ovary that looks like endometriosis. We're like, oh, wow, you don't have any symptoms, but we think you have this disease called endometriosis that could affect your fertility. Do you have fibroids in your uterus? Does the uterus have an abnormal shape? Things that you would not know that you need to think about because they're going to change the landscape a little bit.
You're saying that the testing, it gives you the information to know if there's anything that will most likely be problematic or most likely cause additional challenges, like endometriosis, like fibroids, like a low reserve. But it doesn't necessarily tell you, even if those things are not present, it doesn't confirm that you will definitely be able to get pregnant easily. Is that what I'm hearing?
What you're saying is 100% correct, because your ability to get pregnant at any given time is related to the one egg that you are releasing. And so what's the chance that that one egg is either good or it's not good? And that is mostly driven by your age. And again, this is sometimes where that tailspin kind of comes in, where you have someone who's really young and their ovarian reserve is not good. They have a really low follicle count. That does not mean that it's going to be hard for them to get pregnant if they try to get pregnant tomorrow. But it does mean that if it's going to be harder for them to get pregnant, their options might be more limited in terms of what we can do to try to help them get pregnant, whether that is now or 5 years from now. And is this something where we can get ahead of it? Where maybe you're someone who you're 32 and we're seeing a follicle count of 12, not 20. And so we know that if you're 32 and we're seeing a follicle count of 12, when you're 36 or 37, when you think you're going to be ready to have a baby, that follicle count's now going to be 8. If you want to go through IVF at 37 and your follicle count is 8, is it better not to do egg freezing, embryo freezing now at 32, where you have more eggs and every egg you're going to get out has a higher chance of leading to a baby because you're younger? That's the only caveat to what I would say, is that we use the word like testing your fertility because I think it's an easy way to reach people and talk about it. Because if you say, we need to test your ovarian reserve, some 22-year-olds, what's that? But I think this is why it's really important that you go to the right place, that you have the right person that is explaining these things to you so that you don't take away the wrong message from what the testing shows.
And the wrong message might be, check, I've gotten this information. I have some eggs. I'm good. I don't have to worry about a thing.
Yes. Or the other way around. I only have a follicle count of 3. I can't have a baby. Forget it. I'm not going to try. In both ways, right? And I see this all the time. I had a patient who came in through one of our fertility diagnostic testing programs, which we have this pulse program at Kindbody that does the same thing, where you can come in and you can get a follicle count and an AMH and have a very short, quick 15-minute phone call with a provider just to kind of get the basics, what we're talking about today. And I had a patient who came in and everything was amazing. And she was 35 and she's like, great, I have tons of time. And then a year and a half later, she comes back to me. She's like, we waited for a bit because everything was so amazing with my ovarian reserve. And she came back and she's like, we're trying and it's not working. Can we retest everything? And we retested and her follicle count was decreased by 50%. Her AMH had gone down by 50%. And now she's panicking. She's like, oh my God. Like now I went from like a place where I felt like I had nothing to worry about to a place where I'm not getting pregnant. And now all of a sudden, my options for fertility treatment are not what I was thinking they were at all only a year and a half ago. And this is why it is critical to have someone that walks through these things with you and make sure that you understand that this is a snapshot, a moment in time of what's going on in your body. I cannot, for anyone, predict what their follicle count is going to be in 6 months, much less 2 years. If it's something you're interested in, you can't go once and walk away. You have to kind of revisit this over and over.
And it's hard, right? Because you said at the very beginning of this conversation, you can only make the best decision you can based on the information you have on hand. And yet that information is based on where you are that month. And you have to make decisions like, am I going to put my body through a process like this? Can I afford a process like this? Or am I going to wait and take the risk that it's not going to happen? These are huge decisions that you're making with great information. I mean, thank God we have the technology to explore this information, but imperfect information.
Yes. Isn't that life? I think that's life. I mean, and it's not unique to this. That is life, making decision with imperfect information.
Yeah. I mean, you've just summarized my entire dating experience, right? Or like finding a job or whatever. We've spent a lot of time talking about the logistics of building a family. But one of the things you told me when we first met was, I can relate on a human level to my patients because I've been through this?
When I was in training, because I was exposed to all of these patients that were going through infertility, I started to get paranoid. And of course, I'm a planner, so I wanted to just make sure everything is okay. And I put myself through all the testing, tested my tubes and tested my uterus. I made my poor husband go get a semen analysis when we weren't planning on having a baby for many years. But that is part of why I feel passionate about empowering women and men to know where they're at. Because for some people, they just need that. They are more than willing to wait to try to get pregnant if they just kind of know that they're starting off without kind of any problems that might be there. I did all of that and everything seemed fine. And I was really lucky with our first child. That was really easy. But then at a point where like my partner and I were not aligned about when we wanted our second child, if we wanted even a second child, I said, I'm going to do something about that. And I am going to go through the process of ovarian stimulation and an egg retrieval, and we're going to go ahead and freeze embryos. I am going through this process. I had graduated from fellowship and was a couple of years into practice. And I went through it. I have my ultrasound. I don't have that many follicles. I start my stimulation and my partner is treating me. I don't respond really well. So we have to go up on the medication. And then we get the eggs and we don't get as many eggs as we should. I'm like not that old. Like, why are we not getting enough eggs? And then the eggs come out and the embryologist, she comes to me. She's like, Kristen, we need to talk. Your eggs look really odd. And I'm like, what does odd mean? She's like, well, they're oval. They have like really, dare I say, strange shape. I don't know what that means. Like, how hard was it when you had your son? I'm like, well, it was pretty easy. She's like, well, I don't know what this means. And, these embryos they don't look great. So then I'm going through that same tailspin that all my patients are of like, what does this mean? I was really lucky with my son. I'm not going to be lucky a second time. And I really am passionate about having a second baby, even though my husband's maybe not at the same age right now. And so I have to do this again. And I'm so blessed. I work at a fertility clinic, so it's not scary to me. And then as we're waiting and prepping for the second time, I get pregnant.
Amazing.
I had really luck. I'm so fortunate that I had both my children and it was really easy. But I lived those emotions. And when I hear my patients panicking, I'm like, I was there. I know that feeling.
You've sat in a seat, or if you want to be really cute about it, you've sat in the stirrups. You've had that experience, right?
Exactly. And I use that all the time, by the way, because I have patients that say, oh my gosh, my embryos are not good quality. I'm like, it just takes one. And just because they don't look pretty doesn't mean that they're not going to become great kids. I have 2 great kids and I have really weird looking embryos, apparently. It just takes one.
So I promised only one question, but I have to ask this one. We've been talking about how technology gives us more predictive analytics, better data, more information. And you can say, okay, here are the outliers, positive or negative, and make decisions based on those outliers. But then you just gave us an example where an outlier worked perfectly. And my example too is where an outlier, an IUI round that wasn't really supposed to work, ended up being the one that worked. What do you do with patients who might make major decisions based on outliers, the perception that these outliers are going to cause problems, knowing that sometimes it's a little bit of luck and magic?
Again, it goes back to you have to know like where you are in that moment and what you are willing to do at any given time. Because who am I to say you should not go through IVF 8 times because there's such a small chance that you're going to have a baby? Because I have had patients that have gone through 8 times and it was that 8th time that's their baby. And for them, they were willing to take that risk of going through. And this is where it's like, it's my responsibility that as long as you know what the risks are, as long as you know truly what your odds are of getting pregnant, I am here. I have that role. And then I put on my other role of like, I am now here for you. I am your cheerleader in this part of the journey. And let me be here for you as a guide as we go through. But ultimately, it is your decision, which is hard. I see that. It breaks my heart when I have patients that have been trying for their 5th try. They know, and I know the chances, maybe 10% each time they try. That's heartbreaking for me each time it doesn't work because I start getting anxious. I'm like, oh my God, do we go through it again? Can I let them? But it's their decision. right?
Yeah.
There's autonomy in this. And so as long as I've done my job, I have to feel good that we made the right decision together.
How lucky would we all be to have a partner in this journey like you as our doctor?
Well, thank you. I appreciate that. I try my best.
I mean, it sounds amazing. I'm like, can I go see you tomorrow? I have one last question. This is a question I ask all of my guests, but it's especially interesting for you because you've seen so many families be created. And that is, how do you personally define family?
I think it's hard because I think family is what you make it. You define family. Family is your friends. Family is a sibling. Family is a child. Family is a dog. As I say this, as my 2 dogs are swirling around me, who are my fur babies. Family is what you make. It's what you surround yourself with.
We are sitting here on the day that Kindbody, the company you work with, has rung the New York Stock Exchange, which is really meaningful. Can you tell us where we can find you, where we can find Kindbody? How do we access all the information that you've just shared with us if we want to pursue this further?
You can find me and Kindbody in the usual places. We are online at kindbody.com. I have my own website, drkristenbendikson.com. And you can reach me directly through that website. I have an email on there. You can always find me. I'm also on Instagram, as is Kindbody. So Dr. Kristen Bendikson and Kindbody. You can find us on Instagram. We're on Facebook. We are out there. So please reach out if you have any questions, if you want to chat. I love kind of connecting with patients and hearing their stories. And I love speaking with people like you that are really amplifying our message of we have to talk about this and bring this into the open, which is why it is really incredible that we rung the bell at the New York Stock Exchange today.
It's amazing. Thank goodness we're all having conversations like this a little bit more. And thank you for your time today. It was really educational and so amazing.
Thank you for listening to Stork'd with your host, Julia Carroll. This podcast is changing the conversation around the ways people define and create family. If you like what you hear, please support us by sharing with friends and following on Instagram at Stork'd_podcast. We also always appreciate it when you rate and review us wherever you listen to your favorite podcasts. For more information, visit storkedpodcast.com to sign up for our newsletter. That's STORKD podcast.com.
Many of you know that I use donor sperm to conceive my perfect little angel, and I absolutely credit his donor for, at least 50% of what makes him so special. I used California Cryobank to find the right donor for me. California Cryobank is a full-service sperm bank which specializes in frozen donor sperm, private semen analysis and cryopreservation, and directed donor services. California Cryobank has the largest and most diverse selection of sperm donors, which is really important when you're making this life-changing decision, such as who your child's DNA is going to be, what their genetic makeup can be. They make the selection process easier because, believe me, it can be an overwhelming process, and they make that process a lot easier with search filters and profiles that really help you make a great decision. The profiles that they provide include things like genetic test summaries, medical histories, personal essays, childhood and adult photos, and DNA ancestry reports, all of which are really helpful and a really important decision. Stork'd is excited to share a free Level 2 subscription to California Cryobank's donor catalog. By using the promo code STORK'd, STORKD, at cryobank.com, you will receive free access to that donor catalog for 90 days, which is a great value. It's a $145 value. Definitely encourage that you try it out, and good luck finding your donor.